name is Alex and I'm with the Cook County Health and Hospital System. Thank you so much for joining us today. If you need help making an appointment or finding a doctor, you can reach us at 312-864-0200. I'm here today with Dr. Arnold Turner, and he's the Medical Director of Provident Hospital. Thank you for being here, Dr. Turner.
Thanks for having me.
We're very excited to talk to you today. Now, there's a lot of things that we have to cover, but one of the things that I think is going to be the most important to talk about right off the bat is the deadline for open enrollment for the insurance marketplace. So as you probably know, there's a lot of ways that you can get insurance coverage now thanks to the Affordable Care Act. It's still the law of the land, so we encourage you to take advantage of all the coverage options you have available to you. Now, if you are eligible for insurance through the marketplace, the deadline to enroll is Friday, December 15th. You can enroll by going to healthcare.gov, entering some information, and finding out what plans you might be eligible for. There's also financial assistance available for many people. Medicaid enrollment is opened all year round. If you don't know what you might qualify for, you can call Cook County and speak to one of our financial aid counselors and find out what insurance plans you may qualify for. That number is 312-864-2224. Dr. Turner, can you tell us why it's so important for people to have insurance?
Well, in this country, your access to care is through health insurance. That is your ticket to health care. Ticket to take advantage of opportunities to stay healthy. Have access to physicians. If you hurt yourself, we can't predict when that might happen to anybody. You'll be able to get the necessary treatment and not have to worry about some long-term bills.
Excellent. So we hope everyone takes advantage of the insurance coverage that may be available to them. So Dr. Turner, there's a lot of things going on at Provident that are very exciting. Can you give us a little bit of an update on what's going on at the hospital?
Certainly, I'm very glad to do that. First, I have to mention that we just successfully completed our Joint Commission survey and received accreditation for another 3 years. Actually, just last Friday, our labs were certified by American College of Pathologists for another 2 years. So that's very exciting. So we are able to continue excellent quality health care for the patients that we serve. We've been expanding our services. We now have a full-service psychiatry department since that department moved from Stroger Hospital to Provident. So, and that fills a need that we needed for our patients and for our community. ENT surgical procedures are being done at Provident. We have expanded our primary care services by adding another internist. So we're busy trying to meet the needs of our community. But the most exciting thing is yet to come. We're in the process of making plans for a new regional outpatient center that'll be right next door to the current Provident Hospital. That will allow us not only to move into a new building with our current services, but to expand our services to meet more needs of the community. One of the things we don't have now is dental and oral surgery in the new regional outpatient center. We will have dental and oral surgery there, possibly even orthopedics. We're still trying to decide exactly what services we will bring in as new to that center.
How do you decide what services are offered at the health center or at the hospital?
Currently or in the new building?
Both.
Both? Well, in the new building we'll look to expand the services that we already have a new facility, be able to offer better services, and probably offer some new technologies. One thing as far as diagnostic imaging, we don't have an MRI services there or nuclear medicine, but the plan is to have those services in the new center. We're looking, like I said, we don't have dental or oral surgery, and as you know, our community needs those services.
Absolutely.
We're talking about maybe possibly orthopedics, but we still have to determine what services we can bring there. Right now, we have a host of medical subspecialty services and some surgical subspecialty services. In our specialty clinic, we have asthma, pulmonary services, cardiology, GI, just to name a few, or OB-GYN, obstetrics. We have prenatal care, but we don't deliver any babies at Provident. I mentioned cardiology,
And an emergency
urology,
department, right?
and we have a very busy emergency department. We have over 30,000 patient visits each year in our emergency room.
Wow. Wow. So, as we're looking to keep people out of the emergency room, can you tell us some of the trends that you've been seeing in patients as an internal medicine physician? What can people do to stay healthy, and what have you been seeing in patients over the years as far as disease trends?
Okay. Well, I think one thing that patients can do to stay healthy is be an active participant in their care. At Provident, we have a model called Primary Care Medical Home, where you're not only seen by a physician, but you have a team that follow you to help make sure we not only take care of your immediate problem, but address any issues that should be managed as far as any chronic disease that you have, like diabetes, high blood pressure, high cholesterol, any heart conditions. So we'll help you to stay on top of those so you don't end up in the hospital.
Excellent. So the patient really plays an involved role in their medical care.
Absolutely. Absolutely. That's what it should be. I mean, we're not, I always tell patients, I'm not at home with you. Once you leave the office, you have to make some decisions, and we're there to help you, provide you with information, education to help you make the right healthy decisions once you leave.
Now, are there any diseases that are specifically impacting African American populations that you're seeing?
Yes, still primarily the same ones, such as diabetes, hypertension, cardiovascular disease, and probably one of the things we really need to get our hands around as a community is obesity, which plays a role in all of those. We're seeing an epidemic in this country of diabetes because of obesity. If you make a map of the states and over years track how the percentage of people in the states have become obese, you also see an increase in diabetes. So those two are directly linked, and as you know, with diabetes comes other complications. If it's not properly controlled, it's heart attack, stroke, kidney failure, loss of limbs, which we feel can be prevented with the proper management. But the main thing is prevent that from happening. Prevent yourself from developing that disease.
How is obesity linked to diabetes? What in the body changes to cause diabetes?
Well, when you become obese, you affect your body's ability to manage your own blood sugar. Your body becomes not as sensitive to insulin as it was when you're, let's say, lean and mean. So that's what happens. So you kind of change your physiology where your insulin is not as effective in managing your blood sugar.
What are some symptoms that might tip someone off that they might be diabetic or pre-diabetic?
Well, no symptoms with pre-diabetes, but with diabetes you may start feeling fatigue, going to the bathroom more frequently, have blurred vision, dizziness, don't feel well overall.
If someone's experiencing those symptoms, how soon do you think they need to get in to see a doctor?
If they're experiencing that, they should get in to see a doctor soon. I think the sooner you start addressing your health issues, the better you're off long run.
Mm-hmm. Do you think a lot of people put off going to the doctor because they're nervous potentially?
Unfortunately, yes. People are still sometimes afraid of what they might learn, but the sooner, the better is the way it is with your body.
Excellent. So December is HIV Awareness Month.
Yes.
What do viewers need to know about HIV and AIDS during this month of recognition?
Well, HIV is still a problem. It's still a growing problem in the African American community. So it's a disease that's still where prevention plays a role, having healthy habits, having healthy sexual habits, avoiding at-risk behaviors that can help prevent you getting the disease and also prevent the spread of the disease. We at Provident, we actually have an HIV service there in our clinics. We provide free testing Monday through Friday and actually do over 5,000 free tests over each year.
Wow, that's great. It's really important for people to know their status.
Right.
So December is the time to get tested if you are wondering. What else do you think viewers should know about staying healthy? We're talking a lot about being empowered in your medical care, about paying attention to some of the symptoms that might indicate that you're getting a little sick. What else do people need to know to really take charge of their health?
Well, I tell patients you have to be active. Good health just doesn't happen. You may have it, but you may not maintain it. I think what I always tell patients, one, exercise is a good preventive prevention measure as far as health. Exercise does a number of things. It lowers your risk for heart attack and stroke. Not only that, if you have had a heart attack or stroke before, it lowers your risk of having another one. It can prevent you from developing diabetes. It can help you maintain the proper weight. It can also prevent you from having certain cancers like breast, prostate. So exercise plays a role. Also, good nutrition plays a role. I think we haven't really understood that until recently, that we are what we eat. Having a lean diet, including more vegetables and fruit, actually is a very good thing. I know when I was growing up, my mother would always say that the more colors on your plate, the healthier it is. And that's actually true. The more colors that are on your plate, the more healthy your meal is. So we should pay attention to our diet. And the third thing I always emphasize is that if you do have a chronic disease, take care of it. Be active in managing it. Don't let, just because you're feeling good and you know that you have high blood pressure, not taking your medicines or keeping your appointments or following up on things that you've been advised to follow up, that just puts you at risk for something very bad to happen to you. So taking charge of any chronic disease that you have and establishing a relationship with a physician that you're going to work with to stay healthy.
That's an interesting point, establishing a relationship with a doctor.
Right.
Why is that helpful or important in your medical care?
Well, what I tell patients, physicians, medicine used to focus on just treating diseases. When you got sick, that was the only time you really need to see a physician. But now the focus of medicine has changed. We're actually focusing on prevention and early detection. So if you don't have a relationship with a physician, you can't take advantage of the preventive measures that we have and the early detection measures that we have. So I think everybody should have a relationship with a physician, whether you are healthy or have some disease to manage, but somebody you have a relationship with who gets to know you, and just by knowing you can help a physician pick up on things early.
That's a great point. And one thing you also mentioned was what your mom said about eating colorfully.
Right.
What can families do to really set healthy habits for their kids?
Well, start early. I was talking with my kids just not too long ago, and they were saying that their friends often didn't like to come over to our house because we made them, for snacks, they had things like bananas and apples and peanut butter, whereas elsewhere they might have had something different. But starting early to get those habits in place, so that's the main thing with your children, because they will eat the way you eat. And so starting early, maintaining it. I think when I look at my kids are now young adults, and one of the things we didn't do is have a lot of pop and sugary beverages. So when they go out, they either ask for water or some other beverage, maybe lemonade occasionally, but mostly water. So it pays off starting that practice early.
Absolutely. That's great. Oh, and we have a caller, it looks like. All right, caller, go ahead.
Hi, doctor. I was recently diagnosed with prediabetes, and I'm just wondering, what should I be doing to prevent getting diabetes?
That's a good question. Let me tell you, there was a study that looked at patients who were pre-diabetic, and they divided the patients into 3 groups. One group was a control group. They did nothing with them. They just followed them to see what would happen. A second group, they put them in a diet and exercise program where they changed their eating habits, put them on a structured exercise program where they actually lost some weight. The third group, they put them on a medicine called metformin, which is actually used to treat diabetes. And after a period of time, I think it was a 2-year study, but I'm not exactly sure on that. But anyway, the results showed, of course, that both the diet and exercise group and the medication group had fewer patients to go in to develop diabetes. But guess what? The diet and exercise group was superior to the medicine group. So if you want to prevent yourself from developing diabetes, develop a regular exercise program, which we recommend at least 150 minutes a week, and change your diet. Decrease the carbs and the sugars in your diet, and that will help you prevent yourself from developing diabetes. Of course, lose weight if you need to do that. But it was interesting that it wasn't a medication. It was actually diet and exercise that was the best thing to do.
Absolutely.
That's really interesting. Thanks.
If someone's facing prediabetes, how often should they go in and check in with their doctor to make sure that they're on track to prevent the disease from spreading?
Well, I think that should be discussed with the physician that's treating them, but main thing is not only going to see the doctor, but try definitely to incorporate some of the recommendations that are being made to help you prevent you from progressing on to diabetes. We can't prevent diabetes in 100% of the cases, but it surely can be prevented in a significant percentage of the people who have prediabetes.
Excellent. Talking again about healthy eating habits in children, I understand that you're looking at expanding some children's services at Provident.
Absolutely. I'm very happy about that. For years, Provident had a very active pediatric department, but some years ago that was discontinued, although we have continued to see kids with our family medicine physicians. But sometime this month in December or early in January, we'll be having a new pediatrician on board, Dr. Shipper Sharma, which I'm very anxious to have as part of our staff, and maybe we can have her come on your show once she's on board at Provident.
Oh, we'd love to have her. I'm sure that's a great need in the community.
All right.
Fantastic. What other things are going on around Provident that you think viewers need to know about? We talked about the regional outpatient center. Are there any other services that people might be surprised to learn that Provident offers, like eye services?
Yeah, absolutely. We have a state-of-the-art eye department, ophthalmology service at Provident. We provide comprehensive eye care to patients that are individualized to their needs. We have all the subspecialties of ophthalmology. We have not only do we remove cataracts, but we have corneal specialists, retinal specialists. We even have an ocular plastics doctor, Dr. Kenya Williams, who can take care of those little wrinkles and things around your eyes that you might want to get rid of, or any other eyelid problems. So we can provide excellent, high-quality, comprehensive eye care. And also, sometime in January, we will be offering LASIK surgery at Providence, so to help you get rid of those glasses if you don't want them. So we're looking forward to having a big announcement for that. So bring that service to our community and the patients that we serve. We're very excited about our eye services at Provident.
It's great to see Provident growing to serve the community.
Yeah.
So how long have you been with the Cook County Health and Hospital System?
I just celebrated my first anniversary with the system. I started in October 3rd, 2016, and it's been a very productive and exciting first year.
Well, congratulations. And I know that you've practiced in Chicago for some time.
Yes.
Was there anything that surprised you about coming to the Cook County system?
Not really. My practice has been mostly on the south side of Chicago, so it's a similar type of diseases, similar type of patients, although patients of all economic categories. But a lot of people dealing with the same type of problems, same type of issues. So it's been just doing a lot of the same, but meeting the challenges of our unique community that we serve.
Are you seeing a lot of patients with later stage disease?
That we are, and we want to definitely try to impact that in some way. I think what we feel now in medicine, that we shouldn't see some of the complications that we're seeing from diabetes that we're still seeing now if we get people involved and very active in their care.
What are some of those complications that can be the most devastating?
I think the most devastating the heart attacks, the strokes, the kidney failure for sure, and loss of limbs due to diabetes.
Mm-hmm. And that all goes back to hopefully expanding insurance coverage if people are able to take advantage of the coverage options that are available, so they feel confident in going in to see a doctor more regularly.
Absolutely.
At the health system, I know that you'll see patients regardless of their insurance status or ability to pay or immigration status, but having that insurance card can really open a lot of doors for patients, I'm sure.
It does. It also allows us to provide more comprehensive services on what we can do for the patients too.
Mm-hmm. And even outside of the system, if they need medical equipment or additional wraparound services. Oh, it looks like we have a caller. Caller, go ahead.
Hi, this is John. The holidays are a very hard time for me. I get depressed and I eat too much. What sort of suggestions do you have for me to be happy during this time when I can't find happiness within me?
That's a great
That's a
question.
great question. As I mentioned earlier, we do have comprehensive behavioral health service now at Provident Hospital. If you don't have a relationship with a physician or behavioral health provider, that might be something you want to look into. Definitely that person will be able to help you during this time. This is a difficult time for a lot of people, even those who don't have behavioral health and mental health issues. People who suffered the loss of a loved one during this year, and this will be the first Christmas or holiday season that they don't have that person. That can be difficult for them. So at Provident, we do have those services to try to help you during this holiday time. So you might want to make an appointment, call Provident at 312-572-2900 and ask to make an appointment to see one of our behavioral health specialists.
Oh, great. Thank you.
Thank you and take care. I also want to take this time to remind folks that if you're looking to have a relationship with a primary care provider or a behavioral health specialist, you can also call our Patient Support Center at 312-864-0200, and the staff on that line will be able to identify a doctor near you who can help you with whatever your needs may be. So, Dr. Turner, what are you looking forward to in the new year at Provident?
Well, I guess the main thing I'm looking for is getting that new regional outpatient center going, determining what we're going to put in there, get the building going on the way, putting on a hard hat and sticking a shovel in the ground and throwing some dirt with a lot of pictures and dignitaries. That's one of the main things I'm looking forward to. But also, we're expanding our services again as far as on ambulatory surgery. We're going to be adding oral maxillary facial surgery. I understand we're also going to be doing some breast procedures at Provident in the year 2018. So again, constantly trying to expand services to meet the needs of our community. One thing I didn't mention that I should have mentioned earlier as far as what is new, we've expanded our endoscopy service at Provident. It was only one day a week. Now it's 4 days a week. That allows us to screen for colorectal cancer more at Provident Hospital, which is still one of the prominent cancers in the African American community.
How often does someone need to get screened for that?
That depends on two things. One, whether or not you have a family history of colon cancer. Definitely should start at age 50, whether you do or do not have a family history. Then what follows up after that depends on if you do have a family history of colon cancer, it's done more frequently.
Excellent. Well, Dr. Turner, thank you so much for joining us today and sharing your insight. As a reminder, Friday is the deadline to enroll in Marketplace insurance plans. If you're eligible, you can go to healthcare.gov to see the plans that might be offered to you and what subsidies you might be eligible for. As a reminder, Medicaid enrollment is open year-round, and if you'd like some help to figure out what you might qualify for, please call 312-864-2224 to talk to a certified application counselor. Thank you so much, Dr. Turner.
Thanks for having me.
Thank you.